This session will provide an overview of CPCA as an organization and highlight the services and benefits you receive as a member of CPCA. We'll talk about advocacy, education and training, and business services and programs to strengthen and support your health center. My name is Jody Samuels, and I'm the Deputy Director of Development and Training here at CPCA. I've been with CPCA since the end of January 2012, and I'm responsible for grants management and stewardship for the organization, as well as overseeing our statewide training program. So let's begin with some background information about CPCA. First of all, our mission. CPCA's mission as a statewide primary care association is to lead and position community health centers and networks through advocacy, education, and services to be recognized as key players in an integrated healthcare system and thus improve the health of their communities. And here are some quick facts about CPCA. We've been around since 1994. We live here in downtown Sacramento, just blocks from the Capitol building. Our budget is just over $10 million, and that supports 47 full-time staff. We work closely with 17 regional associations that directly serve and support health centers at the local, county, and regional level. And we also support 2 affiliated entities, CPCA Ventures, which provides loan funds to health centers, and California Health Plus Advocates, which is our 501c4 advocacy arm. This chart shows our 2017 membership numbers, although we recently made a slight change to remove the affiliate category as of April 2018, which is why there's a little asterisk next to that category. Instead, we will begin to offer a new associates program, which is not an official membership category, but it will offer some limited benefits to organizations and individuals that support the work of health centers and aren't eligible for official membership. All right, moving on then. This is a listing of our organizational member types, and you can see that our organizational members are pretty diverse from this list. We have federally qualified health centers, we have lookalikes, rural health centers, community clinics and free clinics, migrant health centers, Indian health service clinics, Planned Parenthood affiliates, as well as the regional associations. In terms of those health centers, CPCA really supports and represents all of the community health centers statewide. This graphic shows the total number of sites across California, as well as the breakdown of clinical services provided by the community health centers as a whole. You can see that California is home to more than 1,300 licensed health center sites, including more than 870 federally qualified health center sites. On this slide, you can see that health centers serve a truly significant number of Californians each year, providing primary and preventive services to 6.5 million patients through 20 million patient encounters. Our patients come from all age groups, and the majority are female. Health centers are a particularly important source of care for communities that are on the lower end of the economic scale. Also, the majority of health center patients identify as Hispanic, and health centers are a critical source of care for migratory workers and for patients for whom English is a second language. Moving away from some of that health center data, let's look now at some of the many organizations with which CPCA partners in order to strengthen and promote health centers. You can see from this list that we partner with organizations at the local, regional, statewide, and national levels. We're also extremely fortunate to have strong relationships with loyal foundation partners, many of which support not only CPCA, but also health centers and the regional associations. And speaking of the regional associations, here is a list of these 17 entities and their leaders. Combined, we refer to ourselves as the RAC, or the consortia. CPCA strongly encourages all health centers to join their regional association because the RAC provide complementary services and support at the county, local, and regional level. Here at CPCA, our staff is divided into 5 departments: executive, government affairs, member services, finance and operations, and Office of Project Management. Now, I know this org chart may be a little bit challenging to see in the slideshow, but the graphic gives you at least an idea of how our staff are allocated across the departments. Blue and pink are the executive level, red is government affairs, orange is member services, yellow is project management and organizational development, and green is finance and operations. And I'm guessing that some of you probably recognize the names on this org chart if you've already interacted with CPCA staff. CPCA is governed by a 30-member board of directors that supports a number of committees, task forces, and work groups. All committee and board meetings are open to members and guests. However, only members can join a committee or serve on the board. These are the current standing committees that report to the board. Each committee meets quarterly in person and sometimes by phone in between meetings. The committees take action on a variety of different issues and topics and then recommend motions to the board. On this slide are the topic-specific task forces and work groups that tackle some of the shorter-term and imminent issues that impact health centers. Again, these groups are open only to members, with the exception of sometimes including subject matter experts who may come from outside the membership. In 2017, CPCA unveiled our new strategic plan, which was informed through extensive member feedback, board input, and external stakeholder interviews. Our efforts are now guided by this framework of 4 bold steps that address advocacy, health system transformation, workforce, and health center value. A summary of the strategic plan can be found on our website. Okay, so now that we've finished talking about who CPCA is, let's talk a little bit more about what we do, and in particular, how you can benefit from your CPCA membership. The first benefit is that CPCA is a powerful advocate for health centers. CPCA contracts with expert consultants to complete research and analysis on issues that impact health centers, such as primary care workforce needs and challenges. We also have an extensive set of activities related to media and public relations, making sure that we inform and educate the public and other stakeholders about health centers, about the incredible work that health centers do, and about the important issues and actions to keep health centers strong. Several years ago, CPCA developed an umbrella brand, California Health Plus, to raise the visibility of health centers statewide. Only members are eligible to use the California Health Plus brand, which is a great tool to leverage the valuable marketing resources that we've developed and promote your health center both in your own community and beyond. California Health Plus branded health centers have access to a library of exclusive resources, including print and electronic collateral and an extensive collection of video clips and photos. A final exciting part of our advocacy efforts is the annual Day at the Capitol, which is a free event to bring health center staff, leadership, and patients to Sacramento to engage with their legislators and staff, to educate them and advocate on behalf of issues that matter most to health centers. This event also includes presentation of awards to legislative champions, a luncheon with a speaker, and an evening reception for all participants. Another important benefit of CPCA membership is our work to strengthen health centers through education, training, and networking opportunities. Our education portfolio includes both web-based and in-person trainings and events. This graphic shows the types of trainings we offered in 2017. We've also been gradually increasing our digital offerings through videos, podcasts, and webcasts. Our in-person education offerings include multi-day conferences, including our annual conference, our billing managers and CFO conferences, quality care conference, and the Region 9 Clinical Excellence Conference, as well as 1 or 2 day specialized training courses, such as the Emergency Preparedness Symposium, FTCA University, NCQA PCMH, or Uniform Data System trainings. CPCA members receive preferential pricing on almost all education opportunities, both web-based and in-person. In addition to the group education and training opportunities, CPCA provides a significant amount of individualized technical assistance to health centers through phone and email contacts. In 2017 alone, our staff in health center operations and government affairs provided nearly 2,900 instances of TA on a wide range of topics. For 2017, the top 5 TA issue areas were licensing and OSHPA 3, billing, patient-centered health home, compliance and HIPAA, and emergency preparedness. An important complement to the individual TA provided by CPCA staff are the numerous peer networks that members can join. These groups are organized by topic or functional role. Each peer network is supported by a CPCA staff, but chaired and facilitated by a member organization. And the goal of the networks is to provide a structured mechanism for health center staff and leaders to consult with and support each other through peer sharing. Most peer networks meet quarterly via conference call, and several of them also meet in person on an annual basis. Peer networks are another benefit available only to members, with the exception of the Outreach and Enrollment Peer Network, which is open to all O&E staff. The last topic I'm going to address today is how CPCA can help to transform your health center through our business services and programs. Please note that more information about all of these services can be found on CPCA's website. And again, keep in mind that members receive preferential pricing for all of these services and products. These programs and services fall into 3 different categories: finance and operations, clinical and quality, and leadership and workforce. Under finance and operations, we offer a program for revenue cycle management, a tool for grants management, and options for different types of health information technology services. The Revenue Cycle Management, or RCM program, is a partnership with PMG that provides expert services for billing, claim scrubbing and edits, rejection and denial management, reporting, electronic remittance advice, and eligibility verification. An independent report commissioned by CPCA and produced by Capital Link has shown the benefit of our RCM program to health centers. For example, demonstrating a significant increase in days cash on hand for health centers that have participated in the program. Many health centers struggle to manage grants in an easily accessible tool. And to help with that issue, CPCA offers Grant Tracker Plus. This online grant tracking tool was designed by and for health centers through a partnership with Civicor. The system currently manages more than $450 million in grant funding with more than 425 active users. This tool can help you more quickly and easily manage the grants that help to support your bottom line and provide the services that you need to provide to your patient. CPCA also offers health information technology services designed for health centers, including a partnership with Blue Novo that can provide cloud-based services, support with implementation and optimization of business systems, analytics tools and reporting, and strategy expertise, all of which can improve operations within your health center. Another technology offering is through a partnership with PointCare. This coverage management platform optimizes enrollment processes to help speed up reimbursements, save staff time, and strengthen patient relationships. PointCare helps you to manage patient coverage, qualify uninsured patients, have a systematic enrollment process, keep more patients covered, manage patient care history, track your clinical encounters, have a more systematic care process, and in the end, help to keep your patients more healthy. In the areas of clinical and quality services, CPCA offers options to support telehealth services, data analytics, patient-centered health home, and patient engagement. We recently entered into a new partnership with CertainTel, which provides a virtual visit solution for health centers. Telehealth services can improve access to care, decrease loss from missed appointments and no-shows, and improve efficiency of clinical services. We all know that data is really important to health centers, and data analytics is a critical component of managing your health center. Data is important for both clinical and quality metrics. CPCA's partner Azara Healthcare offers the Drives platform for improved data management, which helps health centers to track, analyze, and report data across a variety of measures, thus facilitating data-driven decision-making to improve clinical and quality care outcomes. A critical feature of Drive is that it can actually pull data from multiple types of electronic health records. Now moving on to patient-centered health home. Back in 2012, CPCA began to develop a comprehensive patient-centered health home initiative. At that time, primarily to support health centers in applying for and securing PCMH recognition from accrediting bodies such as NCQA, AAAHC, or the Joint Commission. Our PCHH program continues to offer options for training, technical assistance, and customized practice transformation coaching. To this point, we have assisted more than 100 sites through the PCH program and supported 55 PCMH applications. One part of practice transformation also relates to the patients and increasing and improving patient engagement. CPCA's partnership with Care Message offers a powerful and customized web platform to streamline care management and interact with patients through mobile communications in order to improve health outcomes. Another patient engagement tool is the platform offered by Seamless Medical Systems. This platform allows patients to check in at a centralized kiosk in order to review their information and better align with health center workflows and staffing models, which also improves both staff and patient satisfaction. The final category of business services that we provide relates to leadership and workforce. CPCA's Leadership Development Program is called Health Management Plus. This 9-month program consists of 4 in-person sessions and 6 webinars. We have offered this program since 2013, and I was actually a member of the inaugural cohort back when I'd been at CPCA for just over a year. We have now graduated 10 cohorts of the program, providing more than 150 participants from all levels of health center staff to improve their leadership and management skills. And we will be launching an alumni network this year to keep participants engaged in both professional development opportunities and peer networking. We also support the Financial Management Plus program. This program began, similar to Health Management Plus, as a hybrid in-person and web-based cohort model. But we transitioned it to a fully online program in 2016 to better meet the needs of the financial staff who can benefit from this program. This online offering has been more effective in reaching CFOs and other financial and billing staff who aren't able to take time out of the office but can still benefit from the 6-month series of webinars on critical financial topics for health centers. By offering the program online, we also are able to open up those webinar sessions to other interested stakeholders and participants. Finally, in addition to training and developing existing staff, CPCA supports health centers in their recruitment efforts through our online Health Center Careers portal. We have supported this service for more than 11 years, and the site continues to attract new job seekers and employers. Thank you all very much for joining us, and please feel free to contact us with any additional questions. Have a wonderful afternoon, and we look forward to seeing you soon at a CPCA event or training.